Have you ever felt like your mind is a relentless storm of thoughts, making it impossible to grasp just one? Do you find yourself losing track of conversations, misplacing essential items, or battling an invisible force of procrastination on tasks you know are important? This experience of a brain that seems to operate by its own set of rules is a daily reality for millions. If this feels familiar, you are not alone. And there is a name for this experience: attention deficit hyperactivity disorder, or ADHD. For decades, the popular image of ADHD has been a young boy, bouncing off the walls, unable to sit still in class. While that can be one expression of ADHD, it is a drastically incomplete picture. ADHD is a complex neurodevelopmental condition that affects people of all ages, genders, and backgrounds. It can look like the high-achieving professional who secretly feels like a fraud, struggling to stay organized. It can be the artist who has countless brilliant ideas but can't seem to bring them to completion. It's the parent who loves their children dearly but feels constantly overwhelmed by the demands of household management. In this comprehensive guide, we will dismantle the myths and explore the reality of ADHD. We will delve into the three distinct presentations of the condition, examine the scientific reasons behind the symptoms, and uncover the often unseen signs you or someone you care about might have it. Our goal is to replace confusion with clarity and self-criticism with self-compassion. By the end of this video, you will be equipped with a deeper understanding and armed with practical, science-backed strategies to navigate the challenges and harness the unique strengths that can come with an ADHD brain. Understanding ADHD. So, what exactly is ADHD? At its most fundamental level, attention deficit hyperactivity disorder is a condition related to the brain's development and function. It specifically impacts a set of crucial mental skills known as executive functions. It is not a moral failing, a sign of low intelligence, or a lack of willpower. It is a tangible biological difference in the brain's wiring and chemistry that can significantly affect attention, impulse control, and emotional regulation. To understand what's happening, let's use an analogy. Imagine your brain's prefrontal cortex is the conductor of a vast orchestra. This conductor is responsible for executive functions, the skills that allow you to plan, organize, initiate tasks, shift focus, and manage your emotions. In a neurotypical brain, the conductor is generally effective at signaling to the different sections of the orchestra, telling them when to play, when to quiet down, and how to stay in harmony. In a brain with ADHD, the conductor is just as talented, but their connection to the orchestra can be unreliable. This is largely due to differences in the way the brain utilizes key chemical messengers called neurotransmitters, particularly dopamine and norepinephrine. Dopamine is crucial for motivation, reward, and maintaining focus. Norepinephrine helps with alertness and attention. In the ADHD brain, the system that regulates these neurotransmitters is less efficient. This can mean the conductor's signals get lost, delayed, or are not strong enough to get the orchestra's attention, especially for tasks that are not inherently interesting or rewarding. This is why someone with ADHD can focus intensely on a video game for hours, a high dopamine activity, but find it nearly impossible to focus on filing paperwork for 10 minutes. This isn't just a theory, it's backed by data. It's estimated that around 5% of adults worldwide have ADHD, though many remain undiagnosed, often misattributing their struggles to personal failings. It's particularly prevalent for women who are often diagnosed later in life, as their symptoms may be more internalized and less disruptive than the classic hyperactive symptoms more commonly seen in boys. Debunking common and harmful myths about ADHD. Myth number 1. ADHD is not a real medical disorder. Fact, this is unequivocally false. ADHD is one of the most well-researched psychiatric conditions. It is formally recognized by leading health organizations across the globe, including the American Psychiatric Association and the World Health Organization. Advanced neuroimaging studies have repeatedly shown measurable differences in the brain structure, function, and development of individuals with ADHD compared to their neurotypical peers. Myth number 2. People with ADHD are just lazy and need to try harder. Fact, this is perhaps the most damaging myth. Individuals with ADHD are often trying incredibly hard sometimes far harder than others, to manage daily tasks. The issue is not a lack of effort, but a deficit in the executive functions needed to effectively direct that effort. Telling someone with ADHD to just focus is like telling someone with poor vision to just see better. Myth number 3, everyone has some ADHD symptoms, so it's not a big deal. Fact, it's true that most people will occasionally experience forgetfulness or distraction. The difference lies in the severity, frequency, and impairment. For a clinical diagnosis of ADHD, the symptoms must be persistent, have been present since childhood, occur in multiple settings, e.g. at work and at home, and significantly interfere with a person's ability to function in their daily life. Myth number 4, you can't have ADHD if you're successful or can focus on things you enjoy. Fact, many successful people have ADHD. They often succeed by finding work that aligns with their interests, which allows them to leverage a state called hyperfocus. Hyperfocus is an intense, prolonged state of concentration on something stimulating or enjoyable. The core challenge of ADHD is not an inability to focus, but an inability to regulate focus, to direct it where it needs to go, when it needs to go there, and to pull it away when necessary. Myth number 5, ADHD is a childhood condition that you eventually outgrow. Fact, while some hyperactive symptoms can lessen or change in presentation as a person matures, ADHD is a lifelong condition for the vast majority of individuals. In fact, many people are not diagnosed until adulthood, when the demands of career and family life overwhelm their coping mechanisms. Untreated adult ADHD is linked to a range of difficulties, including underemployment, relationship instability, and a higher risk for other mental health conditions like anxiety and depression. The 3 presentations of ADHD. It is vital to understand that ADHD is not a monolithic disorder. It manifests in 3 primary ways, and identifying with one of these presentations can be the first step towards self-understanding. 1. Predominantly inattentive presentation. This is the presentation that often flies under the radar, especially in girls and women. It lacks the overt hyperactivity that is stereotypically associated with ADHD. The struggle is primarily internal. Common signs and symptoms include difficulty sustaining attention, finding it hard to stay focused during lectures, meetings, or long reading passages. The mind may wander frequently. Careless mistakes, overlooking or missing details in work or other activities, leading to errors that are not due to a lack of understanding. Appearing not to listen. Their mind may be elsewhere even when spoken to directly, causing them to miss instructions or key parts of a conversation. Trouble with follow-through. Frequently starting tasks but getting sidetracked and failing to finish them. This can apply to everything from work projects to household chores. Poor organizational skills. Struggling with organizing tasks, activities, and belongings. This can result in messy workspaces, missed deadlines, and a general sense of chaos. Avoidance of mentally strenuous tasks. Procrastinating on or actively avoiding tasks that require sustained mental effort, such as completing detailed forms, writing reports, or reviewing long documents. Frequently losing things. Consistently misplacing necessary items like keys, glasses, phones, and important papers. Easily distracted. Being easily pulled off task by unrelated thoughts or external stimuli that others might easily ignore. Forgetfulness in daily activities. Forgetting appointments, errands, or obligations, such as paying bills or returning calls. Imagine Anna, a talented lawyer who is brilliant at debating in court, but struggles immensely with the paperwork that follows. Her office is piled high with case files she can't seem to organize. She often forgets to return non-urgent emails and has paid numerous late fees on her bills, not because she lacks the money, but because the task of organizing and paying them feels insurmountably boring and overwhelming. She feels a constant, low-grade anxiety and berates herself for not being able to manage what seems so simple for her colleagues. 2. Predominantly hyperactive-impulsive presentation. This is the presentation that most closely aligns with the classic stereotype of ADHD. It is characterized by a feeling of inner restlessness and a difficulty with self-control. Common signs and symptoms include fidgeting, often fidgets with or taps hands and feet, or squirms in their seat. Inability to stay seated, leaves their seat in situations where remaining seated is expected, such as in the office or at a restaurant. Feeling restless. Adults may not run and climb like children, but they often describe an internal feeling of being driven by a motor or feeling constantly on edge. Excessive talking may dominate conversations, talking at length without noticing social cues from others. Blurting out answers, finishing other people's sentences or answering questions before they have been completed. Difficulty waiting their turn, feeling intense impatience when waiting in line or in traffic. Interrupting others, frequently interrupting or intruding on conversations, games, or activities, often without meaning to be rude. Impulsive decisions, making quick decisions without fully considering the long-term consequences, which can manifest in areas like spending, career choices, or relationships. Consider Michael, a successful entrepreneur who thrives on the fast-paced, high-pressure environment of his startup. He is known for his incredible energy and ability to generate new ideas. However, his team finds him difficult to work with. He frequently interrupts them during brainstorming sessions, commits to unrealistic deadlines on a whim, and has a history of making impulsive financial decisions that have put the company at risk. He struggles to relax even on vacation, always needing to be doing something. Third, combined presentation. This is the most common presentation of ADHD, where an individual meets the symptom criteria for both the inattentive and the hyperactive-impulsive types. They experience a significant blend of challenges from both categories. Someone with the combined presentation might be like Chloe, a university student. She has a brilliant, quick mind, but her grades don't reflect it. In lectures, she struggles to pay attention, her thoughts drifting to a dozen different topics while simultaneously fidgeting with her pen and bouncing her leg. She often interrupts the professor with questions that have just popped into her head. Her dorm room is a chaotic mix of finished and unfinished projects. She relies on last-minute, caffeine-fueled bursts of hyperfocus to get her assignments done, leaving her in a constant cycle of stress, exhaustion, and a feeling of not living up to her potential. Contributing factors and risk. While the precise cause of ADHD is not fully understood, research points to a combination of factors. Genetics. ADHD is highly heritable. Studies show that if a parent has ADHD, their child has a greater than 50% chance of also having it. It is one of the most genetically influenced conditions in psychiatry. Brain structure and function. As mentioned, there are observable differences in the brains of individuals with ADHD, particularly in areas related to executive function and attention regulation. Environmental factors. While less significant than genetics, certain factors may increase the risk. These include significant complications during pregnancy or birth, premature delivery, low birth weight, and exposure to environmental toxins like lead during early childhood. It is important to state that poor parenting does not cause ADHD. Actionable strategies and techniques. Living with ADHD means learning to work with your brain, not against it. This involves creating systems and using tools that provide the external support your brain's internal management system struggles to provide. 5 science-backed ways to manage ADHD symptoms. 1. Engineer your environment for focus. What it is: proactively structuring your physical and digital spaces to minimize distractions and support your goals. Why it works. The ADHD brain is highly susceptible to external stimuli. By reducing the number of potential distractions, you lower the cognitive load required to stay on task, conserving your limited executive function resources for the work itself. How to do it. Create a focus zone. Designate a specific area for work or study. Keep it clear of clutter, and everything on it should be related to the task at hand. Minimize digital distractions. Use website blockers and app-limiting software during work periods. Turn off all non-essential notifications on your phone and computer. Use noise to your advantage. Experiment with noise-canceling headphones, white noise machines, or specific types of instrumental music, like binaural beats or video game soundtracks that are designed to aid concentration. Real-life application. Before starting a big project, take 10 minutes to clear your desk, put your phone in another room, close unnecessary browser tabs, and put on your headphones. This ritual signals to your brain that it's time to focus. 2. Implement task management systems. What it is. Using specific techniques to break down overwhelming projects and manage your time effectively. Why it works. ADHD impairs the ability to perceive time accurately and to break large goals into sequential steps. External systems provide the structure to overcome this time blindness and activation inertia. How to do it. Task batching. Group similar small tasks together and do them all at once, e.g., answer all emails in one 30-minute block. The Pomodoro technique. Work in focused 25-minute intervals, separated by 5-minute breaks. After 4 intervals, take a longer 15 to 30-minute break. This technique fights mental fatigue and makes it easier to start tasks. Eat the frog. Identify your most important or most dreaded task for the day and tackle it first. Completing it provides a powerful sense of accomplishment and momentum. Real-life application. Instead of having a to-do list that just says, work on presentation, break it down. 1. Research topic, 3 Pomodoros. 2. Create outline, 2 Pomodoros. 3. Design first, 5 slides, 2 Pomodoros. This makes the project feel concrete and achievable. 3. Harness the power of physical activity. What it is. Engaging in regular, consistent exercise. Why it works. Exercise is one of the most effective non-pharmacological treatments for ADHD. It naturally boosts the brain's levels of dopamine and norepinephrine, the very same neurotransmitters targeted by stimulant medication. This leads to improved mood, reduced restlessness, and enhanced focus that can last for several hours post-workout. How to do it. Find your joy. The best exercise is the one you'll actually do. Explore different activities, brisk walking, running, dancing, martial arts, team sports, to find what you enjoy. Aim for consistency. Strive for at least 30 minutes of moderate intensity activity most days of the week. Even a quick 15-minute walk can make a difference. Exercise snacks. If a 30-minute block is daunting, break it up into short 5 to 10-minute bursts of activity throughout the day, like doing jumping jacks or climbing a flight of stairs. Real-life application. If you have an important meeting where you need to be sharp, try to get in a quick workout beforehand. Use a short walk during your lunch break to reset your focus for the afternoon. 4. Prioritize sleep hygiene. What it is, developing a set of habits in a bedroom environment that are conducive to restful, high-quality sleep. Why it works. There is a strong bidirectional link between ADHD and sleep problems. ADHD symptoms can make it hard to fall asleep, a racing mind, restlessness, and poor sleep dramatically worsens ADHD symptoms the next day, creating a vicious cycle. Prioritizing sleep is non-negotiable for managing ADHD. How to do it. Create a wind-down routine. For 30 to 60 minutes before bed, engage in calming activities. Turn off screens. The blue light suppresses melatonin. Take a warm bath, read a physical book, listen to calm music, or do some gentle stretching. Maintain a consistent schedule. Go to bed and wake up at roughly the same time every day, even on weekends. This helps regulate your body's internal clock. Optimize your bedroom. Keep your bedroom dark, cool, and quiet. Use blackout curtains and a white noise machine if necessary. Real-life application. Set an alarm on your phone for an hour before your desired bedtime. When it goes off, that is your signal to stop what you're doing, put your phone on its charger outside the bedroom, and begin your wind-down routine. 5. Practice mindful awareness. What it is, training your brain to pay attention to the present moment, non-judgmentally. It's not about stopping thoughts, but about noticing them without getting carried away by them. Why it works. Mindfulness is like strength training for your brain's attention regulation circuits. Regular practice has been shown to improve focus, reduce impulsivity, and help with the emotional dysregulation that often accompanies ADHD. How to do it. Start small. Begin with just 2 to 3 minutes of guided meditation using one of the many available apps. Focus on the physical sensation of your breath. Mindful moments. Integrate mindfulness into daily activities. When drinking your morning coffee, for example, pay full attention to the aroma, the warmth of the mug, and the taste just for a minute. The pause button. When you feel a strong emotion or an impulse to act, practice pausing. Take one deep breath before you react. This small gap can be enough to move from a reactive to a responsive state. Real-life application. When you find yourself getting distracted from a task, instead of criticizing yourself, mindfully notice the distraction. There's the urge to check my email, and then gently guide your attention back to your intended task. A practical guide to do's and don'ts. Do's: do embrace tools and technology. Use calendars, reminders, apps, and timers to externalize your executive functions. Do: lean into your strengths. Identify what you're naturally good at: creativity, problem solving, high energy situations, and find ways to do more of it. Do: practice self-compassion. Your brain is wired differently. Acknowledge the effort you put in and forgive yourself for the mistakes. Do: build a supportive community. Connect with others who have ADHD. Sharing experiences and strategies can be incredibly validating and helpful. Don't rely on shame or fear as motivators. They are ineffective long-term and damaging to your self-esteem. Don't overschedule yourself. The ADHD brain gets overwhelmed easily. Build buffer time into your schedule and plan for downtime to recharge. Don't be afraid to ask for accommodations. Whether at work or in school, you have the right to request reasonable adjustments that allow you to perform at your best, such as written instructions or a quieter workspace. Don't compare your journey to others. Focus on your own progress and what works for your unique brain. When and how to seek professional help. While strategies and lifestyle adjustments are powerful, they are often most effective when combined with professional support. It's time to seek help if your symptoms are consistently causing significant distress or impairment in your career, your relationships, or your mental health. What to expect from a professional evaluation. A proper diagnosis is a crucial first step. A qualified professional, such as a psychiatrist or a psychologist specializing in ADHD, will conduct a comprehensive evaluation. This typically involves a detailed interview about your current symptoms and challenges, a discussion of your developmental history, looking for evidence of symptoms in childhood, standardized rating scales and questionnaires for you, and sometimes a partner or close family member to complete, screening for other conditions that can co-occur with or mimic ADHD, such as anxiety, depression, or sleep disorders. Effective treatment approaches ADHD coaching, a specialized form of coaching that focuses on developing practical skills and systems to manage the daily challenges of ADHD. A coach can help with time management, organization, and goal setting. Therapy. Cognitive behavioral therapy, CBT, has been adapted specifically for adult ADHD. It doesn't treat the core symptoms, but is highly effective for helping you develop coping strategies, challenge the negative thought patterns that result from a lifetime of struggles, and manage co-occurring conditions like anxiety. Medication. For many individuals, medication is a transformative and essential part of treatment. It can improve the brain's ability to regulate attention and impulses, making it easier to implement behavioral strategies. Stimulants. These are the most prescribed medications. They work by increasing the availability of dopamine and norepinephrine in the brain. Examples include medications based on methylphenidate or amphetamine. Non-stimulants. These are an alternative if stimulants are not effective or cause side effects. They work differently but can also improve focus and reduce impulsivity. The decision to use medication is personal and should be made in careful consultation with a qualified medical doctor who can explain the benefits and risks. Conclusion. Understanding ADHD is like being given the correct operating manual for your brain after a lifetime of trying to run it on the wrong software. It is a fundamental shift from what is wrong with me to what works for me. ADHD is not a deficit of character, but a difference in cognition. It comes with a unique set of challenges related to regulating attention, emotion, and impulse. But it can also be a source of profound creativity, boundless energy, and an unparalleled ability to think outside the box. The journey begins with knowledge and continues with consistent, compassionate action. By implementing strategies that support your brain's wiring, building an environment that minimizes your challenges, and seeking professional guidance when needed, you can move beyond merely surviving with ADHD to truly thriving with it. Disclaimer: this video is for educational and informational purposes only. The information we're sharing is designed to support, not replace, the relationship that exists between you and your healthcare provider.